Let's take you to this now. Minister of Health Dr Joe Phaahla is expected to visit Mokopane Hospital, that's in Limpopo today, to personally check on the condition of that 8-year-old girl who survived, some say miraculously, following that horrific bus crash in that province on Thursday. Now, the girl stands as the lone survivor of the devastating accident that killed 45 other people when their vehicle plunged off a bridge before being engulfed in flames. The passengers were en route from Gaborone, that's in Botswana, to St Engenas ZCC Church for Easter church services. Now, we also expect Dr. Phaahla to visit the site of this particular crash, which was at Mmamatlakala Bridge. Our Pimani Baloyi is part of our team on the ground who's watching all these developing stories, and she joins us now live. And Pimani, I wonder if you can get us a bit more on the condition of this 8-year-old in the lead up to the minister's visit today.
Good morning, Ayanda, and good morning to our viewers. The latest information that we had around the condition of this 8-year-old was that she was doing well. We saw the Minister of Health here in Limpopo stating that she had gone to theatre for a minor operation and that she was doing well. The surgeon was satisfied with her progress. We'll be getting latest development surrounding that, but what we do know is that her family is around. We know they are being accommodated somewhere around Mokopane, where they are constantly, their mother and father constantly checking up on her, and with authorities saying they are confident that she might be released soon from this hospital. But Ayanda, going back to the minister's visit, as you stated, he will be starting his visit here at this Mokopane Hospital to personally do check up on that status of that young child. That's when we'll get an update. But there's also a second element to this visit, where he's expected to be getting an update in terms of how far the identification process is going. The last time we checked, the Minister of Health had stated that about 9 bodies were recovered from that scene in a state where they could be visually identifiable, but the others had to go through DNA testing, stating that they were working with their Botswana counterparts to ensure that they get DNA samples from the relatives of some of the deceased. And the Minister of Health also stating that there were about 32 body bags that were moved from that site. It did not say anything about the number of people who were involved in that car accident, because what we understand from traffic and transport authorities is that they got statistics from the port of entry where that bus entered from, but also from the bus company that was transporting these people, stating that there were 45 passengers and 1 driver, which made the total number 46, stating that 45 of them did die, other than the child that the minister will be checking up on. So the minister is expected to get that status update. How far is the process of identifying those people, especially the ones that need to be identified through DNA sampling? But also, when can these bodies be repatriated back to Botswana? Because we understand the Botswana government is preparing for a mass memorial service sometime during the course of this week. So that process needs to be done as soon as possible. But the second leg of the minister's visit is going to that Mmamatlakala Bridge, just in between Mokopane and Marken, where this accident happened. Ayanda, I was one of the first people to arrive at that scene, and as you stated, that bus plunged deep into that bridge, about 50 meters down, and it immediately caught fire, and none of the people were able to be saved other than this 8-year-old girl. So the minister will be going to the scene. There were questions around what could have been the cause of death. There were investigations around that. We will find out when we get to the scene whether that investigation has been concluded and what has been found to have been the cause of that accident, that crash at this point, Ayanda. So the minister is expected to get here at around 10 a.m. He will go into the hospital, get that update, then visit that little girl, and then we will move on to that bridge to see if there's now more information that can be revealed about what led to this crash happening, Ayanda.
Yeah, absolutely. And it shouldn't be lost to us, of course, Pimani, that more people died in this crash alone than during the entire Easter season for Limpopo last year. Real questions to be asked about how to prevent a repeat of something like this.
Yes, Ayanda, that is what worried the MEC of Transport, Miss Florence Razilani. She was also part of the team that rushed to the accident scene on Thursday afternoon. And she said last year there were just about 35 road crashes, lives that were lost in Limpopo during the Easter period. And they were hoping for that statistic to go a little bit down. But by Thursday, 45, that number had been surpassed by about 45 lives had been lost in Limpopo, which now authorities say people need to be more cautious, because in this instance the accident happened at around 11 a.m. where they keep telling people travel during the day, but they're now saying people must also be mindful of which routes they use when they travel, especially when they are using public transportation, saying because that road was a bit curvaceous, maybe the bus could have used the N11 instead of using that bus. Perhaps the bus could have used the other routes, but also calling for motorists to ensure that they are not, because we understand what the information that we have is that this was this specific bus driver's first time traveling to Boyne for that Easter pilgrimage, stating that people need to be aware of just the surface that they travel in. If it's their first time, be cautious, be slow, and things like that. So authorities are saying it's quite worrying that statistics keep rising, but they're calling for motorists to be more cautious as they take on trips, especially during busy long weekends.
All right, Pimani Baloyi, thanks very much indeed. An important story that with a number of moving parts, and we'll be keeping up with you as you cover them for us. Pimani Baloyi, live to us now from Mokopane Hospital in Limpopo.